Hello everyone! Today we are going to discuss an important topic in hematology and transfusion medicine, the selection and registration of blood donors. Blood transfusion services play a vital role in modern healthcare. Many patients depend on transfusions during surgery, trauma, cancer therapy, and severe anemia. But an important question arises here: how do we ensure that the blood given to patients is safe? The answer lies in careful donor selection and proper screening procedures. The main goal of a blood transfusion center is to provide safe blood and blood products that are free from pathogenic organisms and suitable for recipient needs. Therefore, recruiting healthy and suitable donors becomes the cornerstone of an effective transfusion service and a foundation for patient safety across medical care. In this guide, we will explain donor types, eligibility screening, registration, laboratory testing, deferral categories, and post-donation care in clear, practical steps. Let us first understand the types of blood donors and why categories matter for recruitment and safety strategies in transfusion services. The first type is voluntary or unpaid donors. These individuals donate freely without payment and are preferred for safety and sustainability. Family or replacement donors give blood to help a specific patient, often a relative. They may be called when hospital needs exceed reserves. Directed donations occur when blood is donated for a named recipient. These are used less frequently and still require full screening and testing. Autologous donation means a patient donates their own blood before planned surgery for later use. This reduces exposure to allogenic products. Commercial paid donors exist in some regions but present higher safety risks and are discouraged where voluntary systems are feasible. Eligibility criteria protect donors and recipients. Common basic requirements include minimum age, good general health, and acceptable weight. Hemoglobin or hematocrit is routinely checked to ensure the donor can safely give blood without becoming anemic. Vital signs including blood pressure and pulse are recorded. Abnormal values may require temporary deferral until stabilized. Medical history focuses on infections, surgeries, medications, travel, and risk behaviors that could affect blood safety for recipients. Pregnancy, recent childbirth, or recent transfusion may require deferral. Certain chronic conditions and medications also affect eligibility. Travel history and exposure to infectious agents guides temporary deferral periods based on regional epidemiology and laboratory capacity. Registration begins with identity verification and recording basic demographic details for traceability and follow-up if needed. Donors complete a standardized health questionnaire asking about recent illness, travel medications, surgeries, and behavioral risks. Informed consent is obtained explaining the procedure, risks, benefits, and the right to withdraw consent at any time. Pre-donation checks include vital signs, hemoglobin, and a brief physical exam to confirm immediate fitness to donate. Phlebotomy is performed by trained staff using sterile technique with appropriate observation time to monitor for reactions. After collection, donors rest briefly, receive fluids and advice, and are given contact details to report any late adverse events. All donated units undergo labor testing for blood group compatibility and infectious markers before release for transfusion. Key infectious tests include HIV, hepatitis B and C, syphilis, and where relevant, malaria, depending on regional risk and guidelines. Blood grouping and antibody screening detect incompatible units and prevent hemolytic reactions in recipients. Deferrals may be temporary or permanent based on health conditions, travel exposures, or confirmed infections. Clear communication protects donors and patients. Donor safety includes advice on rest, hydration, avoiding heavy lifting, and returning to report any delayed symptoms after donation. Repeat voluntary donors are invaluable. A reliable donor base supports inventory resilience and ongoing patient safety in transfusion services. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.